Contrary to popular belief, fatty liver disease can be reversed rapidly. The best part is that you can reverse your fatty liver at home, especially when you are armed with the life-changing knowledge that we are about to reveal in this video, coupled with your precise motivation and dedication. These 10 powerful, evidence-based interventions not only halt the progression of fatty liver disease, but also promote overall metabolic health, further proving that dramatic health improvements are within your reach, provided you come in with the right approach. So, you might have been diagnosed with fatty liver, or maybe you're looking to optimize your liver to prevent it from becoming fatty. Either way, we are sure that you will have many takeaways from this video so you can implement them in your daily life immediately. Okay, listen up. Reversing fatty liver disease requires a combination of lifestyle changes that not only focus on reducing liver fat, but also improving overall liver function. We've done the hard part of researching information for you by compiling it all into 10-step, naturally effective strategies. So let's take a detailed look, shall we? First off is to adopt a healthy diet. By this, we mean balanced meals. Consciously eating a variety of foods including fruits, vegetables, whole grains, lean proteins, and healthy fats. Doing this ensures you get essential nutrients without overloading on calories or unhealthy fats, especially reducing saturated fats. We can do this by limiting red meat, especially the fatty cuts, full-fat dairy products, and fried foods. It's helpful to replace these with lean meats, fish, and plant-based proteins. But what about carbohydrates? It's not a secret that it's effective to reduce the intake of white flour, like white bread, pasta, and pastries. Choose whole grains such as quinoa, brown rice, and whole wheat bread. Gradual weight loss. Aim to lose 1 to 2 pounds per week to prevent muscle loss and ensure the weight loss is sustainable. It's important to establish that rapid weight loss can strain the liver, and we don't want to do that to an already strained liver. It's helpful to roughly calculate what your daily caloric intake should be according to your weight and height. Then gradually create a caloric deficit by consuming fewer calories than you burn. A food diary can be useful, or an app to track your intake and ensure you're eating within your calorie goal. Reducing your calorie intake just wouldn't be enough without number 3, and it's exercising regularly. Engage in activities like brisk walking, running, cycling, or swimming for at least 150 minutes per week. These exercises help burn fat and improve cardiovascular health. Also, incorporating resistance training exercises, such as weightlifting or body weight exercises, at least 2 days a week can be useful because this helps build muscle, thus increasing your metabolism. So, limit your alcohol intake is numero cuatro. Have you ever considered a period of complete abstinence from alcohol to give your liver time to heal? Even moderate alcohol consumption can exacerbate fatty liver disease. When and if you choose to drink, stick to recommended limits. Up to 1 drink per day for women and up to 2 drinks per day for men. Number 5 is a big one. Try to avoid sugary beverages. Many fruits and some veggies contain a sugar called fructose. Did you know that fructose can go undetected by the body's regulatory systems? Yes, it can, and it's due to its unique metabolic pathway and lack of significant insulin response. So it can go undetected, but it impacts leptin production. Leptin is the hormone that signals fullness or satiety. Many of the juices lack the fiber that normally comes with the natural fruit. Fiber helps to release sugar slowly into the bloodstream, thus reducing the insulin spike and leading to a rather gradual increase instead. And now, as you can imagine, when fiber is lacking, this leads to an increased appetite and an lingering feeling of hunger. And this ultimately can lead to leptin resistance, contributing to overeating, weight gain, and metabolic disorders like diabetes. So reducing or avoiding large doses of fructose intake can help maintain metabolic health and prevent related diseases. Instead, try substituting with teas, black coffee, or just plain water. If you're finding some value, please give us a big like and let us know in the comments what your go-to drink is. This very topic brings us to number 6. So let's increase fiber intake, shall we? Some great examples are legumes and whole grains. Did you know that fiber helps regulate blood sugar and can reduce fat accumulation in the liver? Yes, it can. But what should be your daily intake goals? So, try to aim for at least 25 grams of fiber per day for women and about 38 grams per day for men. We reached our 7th point, and that is to stay hydrated. This is a given, so we won't linger long here, but try to aim for at least 8-10 glasses of water per day. Proper hydration helps the liver flush out toxins and metabolize fats more efficiently. Steer clear of excessive caffeine and alcohol, which can dehydrate your body by triggering your kidneys to filter out water more frequently. The importance of consuming healthy fats brings us to the 8th one on our list. Include sources of healthy fats like avocados, nuts, seeds, and olive oil in your diet. These fats have been found to reduce inflammation and support liver health. You can also get your healthy fats from eating fatty fish such as salmon, mackerel, and sardines, or consider a fish oil supplement after consulting with your healthcare provider. Healthy fats are essential because they help to maintain the structure of cell membranes, provide energy, and assist in the absorption of certain vitamins. Additionally, they play a crucial role in reducing bad cholesterol levels, which in turn can protect your liver from fat accumulation and inflammation. I believe we have reached number 9, right? Remember to monitor medications and supplements because some can impact liver health. Always discuss new medications or supplements with your doctor to avoid potential liver damage. So, what can you avoid? Steer clear of substances known to harm the liver, such as certain pain relievers, for example, acetaminophen in high doses, and certain herbal supplements. Next, we have to consider supplements. Some studies suggest that vitamin E supplements can help reduce liver fat and inflammation. What about omega-3 fatty acids? These can help reduce liver fat levels. If you don't consume enough through your diet, consider a supplement after consulting your doctor. By implementing these lifestyle changes, you can effectively reduce liver fat and improve overall liver health. Remember, consistency is key. It's essential to consult with a healthcare professional before making significant lifestyle changes, especially if you have existing health conditions. With the right approach, reversing fatty liver disease naturally is not only possible, but also highly beneficial for your overall well-being. Stay tuned for more tips, and don't forget to like, share, and subscribe for more health insights.